Hello, and welcome to a brief discussion about orbit anatomy. There's just a few important details we need to know about the orbits in preparation for the exam. So let's begin with this diagram. This diagram illustrates that the orbits, rather than being just plain old circles like we see visually, they're actually cone-shaped. And of course, their walls of the cone are made of bone. The rim of each orbit, what we see visually, corresponds to the outer circular portion of the cone, and that's called the base. So again, when we look at the skull, we see the base of this cone-shaped orbit. The posterior portion of the cone is known as the apex, and you can see that point here or here. Of course, apex always, referring to a point. The apex corresponds to the region of the optic foramen through which the optic nerves pass. Now, if you notice, the long axis of the orbit projects upward and medial. So again, upward, represented by this dotted line, and medial, represented by this dotted line. So there's a couple angles then that I want you to be aware of. So when the patient is AP or PA or lateral and OML is parallel to the floor, and that's represented by this dotted line right here, OML being parallel to the floor, each orbit projects superiorly at an angle of 30 degrees. And again, that's the relationship represented here. And medially towards mid-sagittal plane at an angle of 37 degrees. And that is the relationship here. If you wanted to image that optic foramen, you would need to extend the chin so that OML is parallel to the floor and rotate the patient's head 37 degrees. And those angles make sense once you understand the anatomy. All right, let's talk about the bones that make up the orbit. So each orbit is made up of 7 different bones. The base of each orbit is composed of 3 bones: the frontal, specifically the orbital plate of the frontal bone, the maxilla, and the zygoma. And remember, the base of the orbit is that wide outer portion of the cone-shaped orbit that we see externally when we look at the face or the skull. So the frontal bone, the maxilla, and the zygoma. An orbit is made up of a roof, a floor, and then 2 walls. And these 3 bones help to form that structure. The orbital plate of the frontal bone, which you can see here in yellow, forms most of the roof of the orbit. The zygoma forms much of the lateral wall, which you can see here kind of in this salmon or pink color, and some of the floor of the orbit, and then a portion of the maxilla helps to form the rest of the floor as well. So while the previous slide discussed the bones that make up the base of the orbit, on this slide, we'll identify the remaining bones, the other 4 bones that make up the rest of the orbit. So the frontal bone, the zygoma, and the maxilla, we know those form the base of the orbit. And you can see those here. So the frontal, the zygoma, and the maxilla. A portion of the medial wall of the orbit is formed by the lacrimal, and that's in green. That's B. The sphenoid and ethmoid bones make up most of the posterior orbit. Okay, so D being sphenoid, C being ethmoid, again, the posterior part of the orbit. And a small bit of the palatine bone contributes to the innermost posterior portion of the floor of each orbit. And that, of course, would be in purple, that is E. So the 7 bones that make up each orbit include 3 cranial bones and 4 facial bones. And let's just identify them one more time. So A is frontal, B is lacrimal, C is ethmoid, D is sphenoid, E is palatine, F is zygoma, G is maxilla, and H is the orbital surface of the maxilla, but still part of the maxilla bone. So G and H are both maxilla. Okay, so we're going to talk about the openings in the orbit. I'm not going to test you on these openings, but this is just information that was in your text, so we'll talk about it briefly. Each orbit contains 3 holes or openings in the posterior aspect of the orbit. And these openings provide for passage of specific cranial nerves. The optic foramen is a small hole in the sphenoid bone that is located posteriorly at the apex or the point of that cone-shaped orbit. And you can see that here. The optic foramen, of course, allows for passage of the optic nerve, which is a continuation of our retina. The superior orbital fissure is an opening, so that's right here. That is an opening between the greater and lesser wings of the sphenoid bone, and it's located laterally to that optic foramen. The superior orbital fissure allows for transmission of 4 primary cranial nerves, which control movement of the eye and eyelid. A third opening, the inferior orbital fissure, is located between the maxilla and zygoma bones and the greater wing of the sphenoid. The inferior orbital fissure allows for transmission of the maxillary branch of cranial nerve number 5, which permits entry of the sensory nerves for the cheek, nose, upper lip, and teeth. So there's a lot going on in these little openings. The small root of bone that separates the superior orbital fissure from the optic canal is known as the sphenoid strut. You can see that here. Again, I'm not going to test you on these. Please just know that we can do X-ray projections to visualize the optic foramen. We'll talk about that more in a minute. And just know that nerves, really important nerves for our facial functions, pass through some of these openings. So one thing that we won't discuss in the skull pathology lecture are orbital fractures. So I want to discuss those here. There's a few fractures involving the orbits to be familiar with. A tripod fracture, and we've talked about this again in the pathology lecture, but a tripod fracture is a blow to the cheek resulting in a fracture of the zygoma in 3 places. And the reason I mention it here is it does involve the orbital process of the zygoma bone. The maxillary process of the zygoma and the zygomatic arch. The result, of course, is a free-floating zygomatic bone, or what we call a tripod fracture. And again, it's relevant here because it does involve the lateral aspect of our orbit. A second fracture that I'd like you to be familiar with involving the orbit is a blowout fracture. A blowout fracture is a fracture of the floor of the orbit caused by an object striking the eyes straight on. So a baseball is a great example. As the floor of the orbit ruptures, and you can see that here, and remember this is maxilla bone here, the inferior rectus muscle is forced through the fracture into the maxillary sinus, causing entrapment and diplopia, which means perception of 2 images or double vision. So again, some important things happening around the orbits, and fractures can certainly impair our vision. So important to know. Okay, as we conclude this orbit anatomy lecture, let's review these 7 bones one more time. I promise you, you will have questions about orbit anatomy on the final exam, so I really want to make sure you can identify these 7 bones. Remember, A is the frontal bone, B is the sphenoid, C is very hard to pick out on this diagram or this skull, but C is palatine, D is zygomatic, E is maxillary, F is ethmoid, and G is lacrimal. And certainly on the test, I will give you a diagram. I will not give you a bony skeleton. Okay, so since we're looking at a skeleton, let's just point out those openings one more time. A is the optic foramen. And remember, we do take specific X-ray projections to visualize that foramen, which we'll talk about in a minute. B is that little piece of bone called the sphenoid strut. C is the superior orbital fissure, and D is the inferior orbital fissure. All right, and last slide. This is an example of the parietal orbital oblique projections of the orbits. The method name for this is Rees, and we will talk about this when we discuss facial bone positioning. But you can see this is what the Rees method looks like, and this is a projection again done to visualize the orbits and the optic foramen. So real quickly, I'll just point out the anatomy so you can kind of orientate yourselves. This is the right orbit, this is the left orbit. So A, of course, is the top of the orbit. That's our frontal bone. B is sphenoid. C, that is what we're looking for in the Rees projection. We're looking for that little optic foramen. D is the superior orbital fissure. E, switching gears over here, is the infraorbital margin, or the bottom of the orbit. F is the sphenoid strut. G is the lateral orbital margin, or the lateral wall of our orbits, and H is the supra, or superior orbital margin. Again, reading these X-rays is above our pay grade, but I just want you to kind of study these and just kind of look and see if you can identify the anatomy. I challenge you. All right, that concludes the orbital anatomy presentation. If you have any questions, let me know.